Okay, everything we say is on.
Okay.
Okay. Good morning. This is exciting to me in that this is the first. I was just told, I think I'm the only one here that's been another in-person meeting that was back in February. That's on the board. And so this is going to be a new experience for everybody. The last time I was in this room, it was like a mustard yellow. And I always accuse them of, just getting cheap paint. But what I wanted to do before we started officially the meeting, I wanted to ask all the employees that are back there in the corner to, if they would stand and introduce themselves and tell us what you do.
I'm Andrew Rodriguez. I just started with the Yakima Health District. I'm an environmental health specialist.
My name is Mariana Hernandez, and I started on the port team, and I work in the field specialty training.
My name is Brandy Buckler, and I'm the HR payroll generalist. I just started on the 7th of November.
I'm not a new employee. I'm Ted Sylvester. I started August 23rd, 1989 as an emergency hire. And I've been working in environmental health for 3.25 decades.
And further?
And further?
What's happening soon?
Well, on January 3rd, I'm not coming to work.
Well, thank you much. Thank you all. So I will officially start the meeting, bring the meeting to order. And the first thing we're going to do is we're going to retire to executive session. The board will in the next room, and we will start at 8:35 and go for 20 minutes. So we will retire to the next room.
I feel like giving everyone hugs.
That's right, Dr. Perry. I only see this. 6:25, we will reconvene our public meeting, and next up on our agenda is Mr. Ryan Ibach doing introductions of guests and other information.
Okay, so the board members that we have present are Commissioner Anderson, Commissioner McKinney, Councilmember Byers, Dr. Atterbury, Dr. Cleary, Stephanie Algren, Daylene Ackerman, and Nyla Duval. Absent are Commissioner Lindy, who is planning on attending at 9:30 via Zoom, and Jim Curtis, the coroner. Yakima Health District staff that are present are Andre Fresco, Ryan Ibach, Chase Porter, Melissa Sixberry, John McGee, Jocelyn Castillo, Victoria Reyes, James Elliott, Stephanie Badillo Sanchez, Andrew Rodriguez, Ted Silvestri, Mariola Hernandez, and Brandy Buckler. And then in the back, we do have some guests in the public. You would like to introduce yourselves?
My name is Doug Weitz, a resident of Yakima County.
Thank you. Thank you. Thank you for attending. This is our, as you know, is first our in-person meeting we've had since February. New experience. We will move on now to Mr. Ibach doing any written comments or comments in public.
Yep, so we did receive 3 written comments. 2 of them I will read, and then one of them, the person that wrote the comment is here, so she will read her comment. So I'll read both of the comments in full. So the first one is from Melissa Gray. She writes, "My family and many others support the health district staff. Misinformation provided by the non-healthcare professionals need to stop. It will only hurt people. Research shows that these programs are safe, effective, cost-saving tools that can prevent HIV and high-risk injection behaviors among people who need drugs. Preventive services programs help protect communities by preventing infectious disease outbreaks and facilitating safe disposal of use syringes. Yakima healthcare professionals need to make decisions for our community. Thank you." Next one is from Mary Lou Sheehan. And she says, "I'm writing in support of evidence-based programs such as the needle exchange program for reduction of transmission of disease. This is not a program whose primary purpose is to reduce drug abuse, but is used to prevent transmission of disease such as hepatitis B and HIV. As a community, we should be doing everything we can as preventative so that we can protect our somewhat crippled healthcare system. I also fully support encouraging people to wear masks as we go into the cough, cold, flu, RSV, and COVID season. We simply cannot afford to have very many hospital beds taken up from people fighting infectious diseases that we know how to reduce with vaccination programs, masks, hand washing, covering coughs, etc. If we overwhelm our healthcare system, nobody in our community gets good care. We should recognize that there is a gradation of protection from different mitigation actions, and that wearing a mask or taking a COVID vaccine is not a black and white issue, but evidence-based to reduce the transmission of disease. And in the case of vaccines, help to prevent both infections and severe outcomes. And the other comment was from Megan Tweedy.
All of us remember that despite harmful consequences, substance disorder is a complicated disease for both the user and family members. While we don't condone the behaviors associated with the drug use, they are in fact often the result of the drug use itself. We all hope that people who use drugs will seek treatment, however, that is not always the case. Our role as a community is to be ready. In a decade-long dependence on opioids, my brother Jack had periods free from active disease, thanks to medication-assisted treatment. Who's to say he, like others, couldn't have continued to live while enduring the cycle of relapse and recovery. However, because the illicit drug supply is so dangerous, he used alone on his last day alive and died of a fentanyl overdose. Syringe service programs not only provide important harm reduction services like needle exchange and testing, but an opportunity to keep people who use drugs alive by providing Narcan and initiating medication treatment. This is why I encourage the Board of Health to continue to pursue collaborative relationships with agencies who provide harm reduction services. We have an opportunity to come together and support our vulnerable and sick populations through a community podcast.
Thank you. Thank you very much. We'll now move on to consent agenda. There's two items that we will consider approving in one motion. October 26, 2022 Health District Board of Health meeting minutes and the payment of accounts payable and payroll issued in October 2022 in the amount of $663,243.60. Is there a motion?
Mr. Chairman, I move to approve the consent agenda as presented.
A second?
I'll second.
Discussion? Any discussion, comments, or questions? Hearing none, I will call for the roll.
All right, if you're in favor of the motion, please state yes. If not, please state no. Commissioner McKinney,
Yes.
Councilmember Byers,
Yes.
Dr. Atterbury. Yes. Dr. Fleury.
Yes.
Stephanie Ogden.
Yes.
Aileen Ackerman.
Yes.
Eileen, go ahead, Councilmember Duval.
Yes.
Commissioner Anderson.
Yes. Thank you. Is there any other public comments on that? Seeing none, we'll move on. Thank you. Next is a spotlight, the history of the health district with Andre and staff.
Yes, thank you. So we will be working in partnership to share this information. We'll put it up on the screen. Again, for the benefit of our new staff members and our guests, we have what we refer to as the spotlight, where we discuss a specific public health initiative that we're doing in our community to give you a further understanding of the program. And thank you to the board for wanting us to bring that back. And so that's something we'll do each month. We're doing this in honor of Ted Silvestri, who has given many, many years of service. Ted has been here doing things of interest in environmental health, but also supportive of our community his entire career. So we thank him for that. But we wanted to use this as an opportunity to explain that what we do every day in Yakima has really been quite groundbreaking in terms of public health. And it's something that we are exceedingly proud of in terms of serving this community. So we can go to the first slide if you don't mind. So I wanted to just give you a brief background on public health. When the health district was created, it really was part of a groundbreaking initiative to create the discipline of public health. And so how do you explain over 100 years of service in this country simply? And so one way is we talk about what we did in the past, what we were doing in the present, and what we're looking to do in the future, which is explained as public health 1.0, 2.0, and 3.0. It can seem academic, but essentially, I just wanted to convey to you that when we discussed some things in our presentation, there was a time when people had really not a lot of longevity in their lives. You just didn't live very long. And so the reality was, what was the public health system doing to keep people safe when people were dying from things that were preventable, like dysentery and things like that? So that was the first piece. That was the first component. People were dying. We want to make sure they're safe. As people's lives increase in terms of longevity, people lived longer. There were illnesses that popped up that really didn't affect you before. If you lived on a farm and you didn't plan to live past 50, you didn't have to worry about Parkinson's disease. You didn't have to worry about congestive heart failure or cancer, perhaps. And as people's lives grew and as services provided them with an increased lifespan, their lives became more complicated with illness. And so 2.0 was really the public health system looking at that and saying, there are things that we need to address: disease management, disease burdens. How do we have people live longer lives? Public Health 3.0 is what we're embracing today, which is the recognition that, yes, there are issues of disease, but there's also community issues or societal issues that impact people's lives and the choices people make. So if someone lives with a tremendous amount of stress, if they don't have stable housing, if they don't have access to healthcare, if they don't have a stable job and don't have access to health insurance, their lives are impacted negatively. And certainly the impacts of societal obligations to keep them safe, in safe communities where they don't have to deal with gang issues, making certain that they don't die from illegal drug use. These are all kinds of things that we're trying to embrace to keep people alive. And that's called population health work or social determinants of health. But the bottom line, to keep it simple, is that there are many things that affect someone's life, and it's not just whether or not they get health care. So that's important to us in a rural community because we have many people living in poverty, but also we don't have access to certain healthcare needs. How can we increase their lifespan in other areas? So that's a brief overview. You could go to the next slide, please. So epidemiology, or the concept of epidemiology, is the tracking of disease, to keep it simple. And again, we have a lot of people who spend a lot of time thinking about data and statistics, but the bottom line is to address an issue in a community, you have to understand the community and understand how disease impacts that community. And a lot of that started actually in London when there was a cholera outbreak, and it was actually traced to a water source. And that sounds very simple and straightforward, but that was really not understood. And it's not just the birth of epidemiology and the birth of public health as a discipline, but it's also a recognition of the impact on the earth. What happens in the ground, where we live, how we live in our environment has an impact on us. And that's something that seems very straightforward today, but that was not something that made sense. As something as simple as don't put your latrine upstream from your water source. That sounds like good business practice today. That was not understood. So those are the kinds of things. Next slide, please. Thank you. So we actually started as a system because of a typhoid outbreak in our community that affected the water supply. And it was made clear that a lot of that had to do with sanitation. And this is back in the days when you had horses and refuse, and you didn't have a lot of sort of what we would consider as the infrastructure of a community. Where you place your garbage and where you place your outhouse has an impact on your health. Where you get your clean drinking water has an impact on your health. Where you have your cattle or your livestock living near you has an impact on your health. Those were the days where people could often live right next door to where they kept their animals, which was very common practice. At any rate, this was the typhoid outbreak that created a need to have what we call interventions from a governmental source. And so it was decided to create a public health district. And what was unique was it was the first public health district in the nation. And so we are not only the first, but the longest running public health district in the entire nation. The district was created not as a component of county or city government. It was its own entity. So I'm exceedingly proud of the fact that this agency has provided over 100 years of continuous service for this community. And it started with a physician, it started with a sanitarian, it started with a nurse. So stewardship of the earth, the land was important from the beginning, and it's part of what we do in environmental health all the time. Next slide, please.
References back to 1989, there was a meningococcal epidemic. They noticed an increase in cases. There were 15 diagnosed cases by March 10th of 1989. Representative Dr. Atwood, who was the previous director about this many years ago. But in response to this epidemic, the YHD staff were working 16 hours a day. They had over 900 volunteers that worked to help get clinics set up over a 5-week period to be able to vaccinate people, and almost 60,000 people were immunized.
Let me put the hat on. Apparently there were commemorative hats made. So this was the 1989 commemorative trucker hat, care of John Wilson, who has lovingly kept it on his shelf all these years.
So back in the 1990s, throughout the country, there was a lot of meth labs and meth use going on. And in Yakima County, actually, we were the third busiest county in the state of Washington, and we were the third, as a state, we were the third busiest state with meth labs. And so our staff was very busy on working with the Department of Ecology. They'd get a list of chemicals that were being used at the meth lab sites. And we had an environmental health specialist that would go out, they would evaluate what was going on at the property. They would list it unfit for to live there. It would be put on the title of the house that it was a meth lab. And then they're also in charge of making sure that contacting the owners of the property, sure it was fully cleaned up to satisfaction before they can, people can move in the house and live. That we spend a lot of time working with a lot of different agencies, Department of Ecology, with a lot of law enforcement agencies. Law enforcement agencies would go in and they would do the bust at first, and the Department of Ecology would remove chemicals, and then that was when we did our part to make sure that that it was safe. Slide.
Right. Also in the early 1990s, there was a big housing was happening in Yakima County. What this meant for the health district is that there was a large increase in demand for on-site sewage and septic systems that needed to go in. Due to this increase in septic systems needing to go in the ground, the application process for the health district back then, due to limited staff being trained in on-site sewage, the waiting period could be up to 8 weeks. And it's vital that these are done right, because we're talking about protecting groundwater, surface water, going back to the roots of getting rid of wastewater in a proper way. Since then, during the 90s, there was kind of a revamping of the on-site sewage programs, how we process our applications, how we do our inspection, to make our program run more efficient. More recently, and I've mentioned this in the past, we have all of our staff cross-trained everybody, bringing that generalist model into our environmental health program. Now, during the busiest time of the year, our wait period is typically 1 week. Sometimes it gets up to 2 weeks in the real busy, but we've drastically reduced that wait time for our community members today. Also, what we've noticed is a lot of property owners are first-time homeowners. They don't know what goes into building. They don't know about their drinking water well, how to properly place that in the location of safe, how to locate a septic system where it's not going to affect that well, or the neighbors. We bring a lot of education to our process that by the time people go through it, they understand the importance of this private facility they have on their property, how it affects them and people around. Also, it does tend to happen. We work off site plans on building permits and stuff. Sometimes they get changed without us knowing. So when we go out to our sites, we always try to do our site evaluations where we have our third area for our septic system. We do understand sometimes the homeowner might say, well, I want my house a little higher, or I want my house a little lower, and that kind of thing. So we bring a lot of education and a lot of alternatives to every property we do. Our ongoing effort make this program.
All right, back in January 1993, there was an investigation launched because there was a high incidence of children with HUS. And so there were 602 cases in Washington State, and the majority of those that were affected were under the age of 10. There was 171 hospitalizations and 4 deaths. It was tracked down to E. coli contamination at the Jack in the Box restaurant. They were cooking hamburgers to 140 degrees instead of 155 degrees. 140 degrees was the national standard, and 155 was Washington standard. So this had a big effect on the Yakima Health District because basically that changed the way that restaurant inspections were done. Instead of looking at dirty floors and paint chipping on the walls, they started focusing on high risk issues such as temperatures, proper cooling, proper hand washing, and sick food workers. In Washington State, there was a total of 602 cases from this outbreak. The majority of them were affecting kids under the age of 10, as I mentioned. And like I said, it had a big impact on the Yakima Health District. And then the next slide, the Yakima Valley floods in 1996. So in mid-February 1996, Yakima experienced the 3rd large basin flood that it's ever had. As you can see in the picture on the right-hand side, I-82, going under the overpass was flooded, and you couldn't even drive on the freeway. Several feet of water from that flood. This happened, heavy snowfall that year in February, followed up by warm temperatures and rain caused the flooding. Closed down I-82. The flooding forced a water line break at 38th and Tanum, which served about 17,000 residents, and also many drinking water wells were contaminated. So the Yakima Health District got a lot of phone calls, what do we do about our wells? How do we decontaminate them? How do we chlorinate them? We had a testing lab at the time, a drinking water testing lab. And so we were, I don't want to say flooded in with tests, but we got a lot of people bringing tests in to get their wells tested. And basically our staff could recite the way to the 5-step process, how you can chlorinate your well, without even thinking about it, because we got so many questions, nonstop questions for several days. Next slide. 1997, there was a salmonella outbreak. This was caused by queso fresco. This is a cheese that mostly made by the Hispanic population. Investigators from the CDC and the Yakima Health District linked about 90 cases of salmonella with the consumption of this queso fresco. 91% of the cases occurred in the Hispanic population and affected many children around the age of 4. And so there was an investigation done. And once we found out what the problem was, then it was, okay, what can we do to change the habits of the Hispanic population? So next slide. So what was developed working with the Washington State Department of Agriculture, the WSU Extension and other partners was to come up with the Abuela project. The Abuela in Spanish means grandmother. And so the Hispanic population, they wanted to use unpasteurized milk, which was the cause of this outbreak. And so they got started out with 15 respected female volunteers, mostly the elderly generation, and to work on a new recipe using pasteurized milk. And then using those 15 respected elderly in the community, then would teach other people, because that was the main problem was convincing the population that you can actually make queso fresco with pasteurized milk, and it's still going to taste the same, but it's going to be a lot safer. And so additional people learned how to make the recipe, and then the results were phenomenal. If you go to the next page. Let's see, after the safety workshops, people learned that there were health risks associated with eating raw milk. It includes people to make changes, and it went down. Like I said, there's the data that shows that we did see a large decrease in the number of cases of salmonella, but the consumption didn't change at all. So the consumption didn't go down. Consumption stayed the same, but the cases went down. And this got national attention, and we have awards that we received from that, and same with Washington State Department of Agriculture. And next slide. So before I go into this next slide, a couple things I want to bring up that the Yakima Health District was involved in was back in 2003 in the UK, mad cow disease was going around, and hundreds of thousands of cattle were being killed because cows were becoming paralyzed and they were dying. People eating the meat were getting disease. For real. Yeah, how to pronounce it? You want to give a shot at it? Yeah, there you go. Yep. Yeah, and so
I know that you were just about to say that.
And so so there was big concern in the United States that would this come over to the United States. And so sure enough, on December 9th, 2003, a cow from Mapleton, Washington was at Moses Lake at the slaughtering plant, gave birth and became paralyzed. So this caused a lot of suspicion. And so samples were sent to Iowa to be tested, and we did test preliminary for mad cow disease. And so immediately a military jet flew samples to England, and it was confirmed that it had mad cow disease. So the United States Department of Agriculture held a press conference in Washington, D.C. to announce that in Mapleton, Washington, there was a first case of mad cow disease in the United States. So of course, this brought a lot of attention, or a lot of phone calls, a lot of concern to the Yakima Health District. And so staff was answering phone calls as far as is the meat safe to eat? And it even where there was concerns about the blood supply. And so that temporarily halted giving blood for a little bit, because to make sure that blood was safe. It wasn't in the blood. And there was a lot of, we had a lot of federal officials coming to town. We had a lot of reporters throughout the United States coming to town. And so one thing that you would think about is that the Yakima Health District was in charge of a lot of logistics. You know, where do these people stay? How do they get around? How do they know, where to go? And so we helped out a lot in that type of logistics stuff. But there was also, you had to trace where this cow was. So it turned out that it was a contaminated feed. And so any cows that ate that same feed had to be traced back and had to be recalled. When you go to a slaughter plant, it doesn't just end at the slaughter plant, then it goes to the boning place somewhere else in the state. And then it goes to, once it's cut up, then it goes to the distribution center. So that had to be retraced. The feed had to be, where does the feed go? All the different maybe farms, cattle farms that it went to. And so there was thousands of cattle that were killed because of that. But luckily the meat didn't get into the supply chain because it was caught at the distribution center in Portland. Next thing that I want to talk about too is West Nile virus. So West Nile virus was in the United States, started out in the early 2000s, started out in the East Coast, worked its way to the West Coast. And so by 2000, it started out in 2003 in the East Coast, and in 2005 reached its way to Washington State in Yakima County. West Nile virus is carried by birds, and so mosquitoes bite the birds and then can transmit it to people. And so what we did was we had bird surveillance. So there's certain types of birds. So there's magpies, crows, and blackbirds that carried it. And so anytime there was a dead bird, we would get a phone call and we would send it to the state to be tested. So it was interesting because we get thousands of calls each summer, because any dead bird, people were calling us, but it was, we had to educate that it was only certain types of birds that were testing. So after about 3 years of doing that, it was decided that West Nile virus is definitely here. We don't need to continue testing. And so every year, even as far as this last summer, we do a press release when we get our first West Nile virus case. And we don't test any birds. We still, once in a while, we'll get a phone call asking for, I've got a dead bird in my yard. You want to test it? I'm like, nope, we know, West Nile virus is here. So that's another thing that we were really involved in the early 2000s. And the next one was the Grandview chemical fire incident, which happened January 26, 2005. There was a fire at the pesticide storage facility in Grandview. This was one of the largest hazmat incidents that occurred in Washington, in Yakima County. So there was an evacuation of about a half a mile radius around the fire, what the makeup of the smoke was. So this affected restaurants, homes, schools were shut down for a couple of days. The Yakima Health District was responsible for determining the final evacuation of the area and also when we can re-enter. So the Department of Ecology sent a hazmat trailer to the area, worked closely with fire departments. There was constant air monitoring. There was constant testing of like playground equipment at schools. We went around all the restaurants, making sure that they're closed. And when they reopened, we went in and let them know, make sure you change your filter. This is how you clean your facility. And so that lasted about 3 days. And Ted was heavily involved in that, along with a lot of these other events Ted was involved in. So 400 people were evacuated from their homes, and I-82 was actually closed for 17 hours, which also caused a problem because getting emergency vehicles and like hazmat units and with the closed facility, you can imagine if I-82 is closed, there's a lot of traffic backup. Next.
Okay, so in February of 2019, a really severe winter storm hit Yakima County with a blizzard hitting the lower valley with 70 to 80 mile-an-hour winds. Temperatures dropped severely, lots of snow and ice coming down, and it led to the unfortunate passing of 1,850 cows, or around 1,850 cattle. Seems like the cattle can't take a break. But so this was a local event, but there was really no agency in particular that really had the ultimate authority or jurisdiction to handle this. Is it an imminent public health threat? The Department of Agriculture have the authority to tell areas what to do. But what was great about it is a lot of partnerships built in response to this event. So Yakima Health District Emergency Management, worked with Dairy Federation, Department of Ecology, and State Department of Agriculture to come up with a plan to dispose of these cows. The time was of the essence. They were warmer temperatures in the forecast, and you can imagine what it would be like if that cow started exposed. Not only are we looking at groundwater contamination, we're also looking at snow. So a lot of the cows were hauled off to a landfill down near the Washington-Oregon border, but it couldn't take all of them. So we were left with, I can't remember the exact number, maybe close to half, maybe a little less than half, that we had to do something. So it was determined that we would create compost. We could cover the cows in an area where groundwater was far below the ground. So they wouldn't be able to get there, and the cows would decompose without, emanating a really strong smell. So over the next few months, working with these agencies, Ted would be out there starting out weekly to take temperature compost pile, recording those, making sure that everything was happening the way it's supposed to. You got to maintain certain temperatures for compost to actually work. And over the next few months of doing that, it was determined that the compost was successful. There was literally nothing compost that could be used. So, work in great partnership with other agencies to really respond to an event that got a lot of attention locally and I think statewide. But we were getting calls from different folks that had a wide range of different concerns about this event and what's happening. Really unfortunate event, but also a good success story on how.
Well, that's a lot. And we did want to, again, honor Ted's work by discussing some of the things we've done over the last 30 years, but recognition of a few things. One is we work in the public eye. So what we do is often very public, and people have very strong opinions about that. And we want to be respectful of those opinions and recognize that we serve many different constituencies. When we're dealing with something like the loss of cattle, honestly, you're dealing with farmers who love their community and they love their land. And they also were devastated by the loss of their livestock. And they had to also deal with that loss in a very public way. Those are the kinds of things that we deal with every day. And I do share this with you in earnest because we are a responsive organization. What the community needs, what the community demands is what we respond to. So that's really critical because there's the day job and there's the regular service, and then there are these needs. So sometimes we use the term like emergency response or disaster, but it's really community need. That community need can be something environmental, but it can also be the use of illicit, illegal, and dangerous and deadly drugs in the community. So again, a responsible organization. I just want to go back again to this slide to recognize that our work is all three of these things at once. There are the fundamental issues that created the discipline, which have to do with health and safety and land stewardship. It has to do with the management of disease and particularly preventable disease and the recognition, frankly, that some communities and people are affected differently, disproportionately by those disease burdens. And then it's the new agenda, which is recognizing that the community and how the community is in terms of health impacts our entire community and our wellness. So those are the things that we're working on collectively all day, every day. And with the board's attention and direction, we'll be able to really address these issues because our community really is imperiled in many areas and we want to be effective at our work. Next slide, please.
All right.
Who is that person? Who is that?
Ted Silvestri, environmental health specialist, retiring with over 32 years of service at the end of the year. To put it in perspective, it's about 30%. We've been a part of a lot.
Wow.
What's happened in major events, emergency responses. He was a lead in our solid waste and drinking water programs for many years. We formalized the water program, standardized it, working in close partnership State Department of Health and bring it to where it is today. Again, he helped with the meth lab cleanups, the grand chemical fire, cow disposal, flood in '96, and many more not mentioned in the presentation. So I just want to say, on behalf of current and past employees of the Yakima Health District, we all thank you for his dedicated service, positive attitude, working stories, and just, you know, it's a great food. Thank you, guys.
Hey, thanks for paying me.
So that concludes our spotlight. Thank you.
Thank you much. That was a great overview and a great compliment to Ted. Ted, I don't know if you remember me or not, but we met a long time ago, and so we've known each other. I've known you anyway for many years. And again, I want to thank you on behalf of the commissioners and behalf of the health district for all your service and your dedication. Thank you. Now we'll move on to the exciting part of our agenda is Mr. Chase Porter.
All right, I'll wait. Everybody around us. Everybody else here.
First copy.
The financial part of this page 10, I think we will be up on the I gotta admit, I am a little nervous this morning. I'm not used to having my spreadsheet right here. I'm right here, so I'm kind of looking at my security. Bear with me here. So for the month of October, we'll be beginning October this month. Beginning in January, we'll be October, we have $39,000 in. Under that, bringing our annual access up to $1,050,000 for our access revenue. At our revenue, our allocated budget for the year was $17.2 million, and we're actually coming in around $9 million. For expenditures, we have budgeted $17.4 million, and it's coming in just under $8 million. Is there any questions on the summary? All right, moving into the income statement. We discussed earlier in the year, and we kind of started to see a shift away from federal funding. Federal funding was the majority of our federal funding, and it's moving into foundational health. We started to see more of an investment in public health and foundational public health. Beautiful that the state is trying to invest more in public health. The majority of our expenditures are under budgeted. Last year we budgeted for full COVID activities, and we have not seen that. Questions on the income statement? Unless there's any questions, there's really no programs I want to address specifically here. We're trying to start to see a shift from COVID activities for the community diseases into more of a STI/STD program. Our COVID expenditures through October are coming in at $2.8 million. This time in 2021, October 2021, it was $6.6 million. So a dramatic drop off that we've seen in the COVID expenditures about 50% due to COVID expenditures compared to last. Finally, the last page. Actually, you see the slight downtick in the month of October. That's to be expected though. We get investment. We get from January and July. The foundational or the public health services and foundational. We got investment. And so we're starting to see those start to pick up. I'm not sure if I answered. Any questions you guys?
Any questions for Chase? Not, I'll entertain a motion to approve the financial report for the month of October 2022. Been moved. Is there a second?
I'll second.
There's a motion and a second. Any further discussion? Hearing none. All those in favor?
Aye.
All those opposed? Thank you much. Now we'll move on to the reports. And first report is Mr. Andre Fresco.
Well, good morning. Thank you for all being here. First, I just want to recognize that it's been years, literally, since we were in person. And I'm grateful for that. We have had a tough road, but we are here together, and I'm grateful. It's our last board meeting of the year, and we have a lot of transition, but we remain optimistic in the future. And in that vein of optimism, we've repainted. I want to just share candidly that most things don't change in government because it takes a lot to change them. So things as simple as painting walls takes effort. And certainly having new technology is something that we don't often get the chance to invest in. So thank you.
And if I can interject my constant complaint about the mustard colored wall.
It didn't go unnoticed. And thank you for your patience because Mr. Anderson was very clear he wanted to paint it. And I said, really, there's a couple other things we're working on right now, but we definitely intend to do so. But coordinating that with technology, with the time and effort that goes into, again, meeting and exceeding standards with public dollars was really the work of Victoria and Ryan. I want to thank you. And it also is important to me that we have things like technology for our staff. So new computers, really feeling good. I do feel terrible with all this innovation and all this increase. I'm realizing that Chase now has to go back to a paper copy. So we might have to get him an iPad or something because he's gone backwards in time now. But we do recognize that this really is about service to the community, which also means constant service to our staff. And so the staff have new technology as well as us. So thank you for that. I wanted to begin today by recognizing again, some of the transitions that we're having, which is the departure of some of our board members. I'd like to begin with Ryan Anderson, who's been a very long-term board member with us as a county commissioner, but also as our board chair. Ron has been supportive of us, candid with us, understanding through difficult times, and recognizing that being basically a chair of a department that's different than his elected position takes a great deal of work. And it wasn't just a behind the scenes position, it was an upfront position, which makes it even harder. So it's been an unprecedented time, and I want to thank you for your service and share this plaque with you, which I haven't dropped or broken.
Well, thank you. Appreciate it.
Thank you. Next, I was hoping to recognize Councilmember Natalie Duval, who has been with us and true to the idea that she wants to speak truth to power and to allow us to really speak for those who may not be heard. She's committed a tremendous amount of time personally to this work, and we recognize that it's not always easy to juggle volunteer responsibilities and city council responsibilities, and also the recognition that we had more board meetings and at different times and long meetings. And she was very committed to that. So thank you, and appreciate your service.
Oh,
Thank you.
and I mentioned to her a little bit earlier when I walked past her, I stopped and I said, "Oh, I didn't realize you were so tall." Of course, everybody's mostly taller than me, but anyway, it's the first time we've met in person.
A lot of people,
Yeah.
first time.
And last, I'd like to recognize Dr. Clary as a citizen board member, but also a physician in good standing in our community, who has brought really a career of expertise to our discussion, who has an eye for detail, who has a recognition of the fact that data matters, that communication matters, that integrity matters, who has made clear to us that he believes in service and came to this community, not because it's easy, but because it was worthwhile, because there are people who needed care, there were people who needed to be helped, and he's always done so with conviction. So I want to thank you for your service on our board. And I do want to share also that Ryan and Victoria have been in charge of getting us nice plaques for people. They get to hear me complain. There's nothing tackier, I think, than cheap governmental tokens of appreciation. If you're going to do something, you ought to do it right. These are volunteer positions, but even for those of us who are elected, it's still added in additional work. So I think many people who aspire to governmental service don't recognize the investment of time and effort and value that people place in this work. So I want to thank not only those of our members who are departing, but also our current members and future members of our board, that we take seriously your service. You are also governmental service employees in a sense, and it's very, very important. And without your direction and support, we wouldn't be able to do our work. So thank you very much.
Can I just mention for those who have your award, I have the box they came in, so if you want to leave it there when you don't break, just meet me after the meeting. And I'll
Good. Thank you much.
Yes, I thought it would be acrylic, but when it was glass, I became nervous. So I feel like my work is done. Of all the things I had to worry about, I didn't drop it. So that's good. I also want to just take a moment to, again, add my reflections on Ted's service. Ted was welcoming to me when I came. He's a source of knowledge and expertise, but there's things about Ted that many people may not recognize, which is that he is an optimist by nature. He believes in public service. He believes in serving others. He's the type of humble leader that we've always had at the health district, but often those people don't get recognized. And this work would not be possible without people like Ted, who commit quiet years of service on behalf of others who may not even recognize that their lives are better because of him. So something as simple as a septic system that's installed correctly has impacts for decades and decades, and impacts people's livelihoods, and impacts their future and their safety. His service has been sort of the glue and the example for all of our staff coming on. So I want to thank him for being with us. Plus, he's always been good for a great environmental health shirt. And those are important things. Now we're passing the gauntlet on to Sean.
Is that the new shirt, Sean?
Literally.
Okay.
So I wanted to move on to a few things, if I may, that I think are necessary to discuss. First of all, we spent a little longer in the spotlight, but again, this is a big deal that we're back in person. There's a great deal of work to do collectively. It is interesting that and fortuitous that our first meeting in person is also preparing for next year. There's a lot of work to do on behalf of others. And we at the health district recognize all the time that we're serving a rural community. It's also a large geographic community. And I share that with you because I think sometimes we haven't had those discussions. Providing quality governmental service in a rural community, in an interesting community that's very, very large, second largest geographic community in the state, takes time and effort. And so from an equity platform, we are really working very hard to make sure that we provide services throughout Yakima County. We want to provide services where people live, where they shop, where they recreate. We don't want to be just waiting for them to show up at the health district door. We're actively engaging them. So that's something that's part of our process and part of our mission. And as Sean mentioned, one of the reasons that we do cross-training. Our cross-training is not just in environmental health, it's really in all of our departments. And so working collectively to do things on behalf of the community has really worked not only in our health district, but also partnerships with other agencies. And that's part of our goal, is to maximize our impact in this community. I wanted to share with you also that as we transition away from finances for COVID, as was mentioned by Chase, we also have another funding opportunity, Foundational Public Health Services, which is something that we've been actively engaged on for a decade. The goal was to have an investment by the state in public health, in local communities, along a set of criteria, mind you, so that there's consistency, but that is really about providing services that are customized for the needs of the community. So obviously the investment that would be made in Tacoma, as an example, or Spokane would be different than the investments we make here. But I want to be very clear that it's confusing and it's technical, and sometimes these things that I'll say foundational public health services really doesn't mean something without an explanation. But it's an investment in our local public health system. And that has allowed us to not only hire new staff, which you're seeing, but it's also allowing us to strengthen our infrastructure and also retain quality staff that we met and trained during COVID. The idea that people actually came to us wanting a career of service means something to us, and we want to be able to allow them to continue to do work in a different way. That's also one of the reasons we do the cross-training we do. It's organizational, and sometimes it can sound very technical, but a quality organization is only as capable as the staff that come to work every day, and also their training so that they can pivot to do the work. So again, that's really about us blending funding and blending opportunities so that people are ready to respond when need be. So that's our goal for the future, because there's a tremendous amount of work. You'll forgive me, but I took some notes and I wanted to talk about it. We are well positioned financially for next year. We are staffed up for next year. We have people who care about the work, and we are committed to training. We're committed to providing them with the resources and tools that they require. I want to thank you all for your understanding as we did things like purchase a new vehicle, which we hadn't done. I'm reminded that the vehicles we purchased for the transport of our staff are safe and have all-wheel drive, which is not something we always had, which is wonderful. We have a fence, thank you, Ryan, that took many months to build. He didn't have to build it, but I think he knew how to build it by the end of it because it took a while. But again, we don't want people stealing our inventory. We're also well positioned for training. There's money in the budget for staff development. It's really a wonderful opportunity to reflect on the fact that despite the hardships that we all face in this community, we are positioned well to address those issues. And if I can be honest, our staff is a small staff. We're considered a medium health district by state standards, but it's a relatively small staff to provide the kinds of change that we require. But that's why we're going to be working in partnership with other organizations, because again, collectively working together, we can do more on behalf of the community. I owe you an update on some of our work. We mentioned last month that we had funding from the Kresge Foundation to invest in partnerships with comprehensive healthcare, which we're actively working on. That's our goal through the end of December, and we actually are going to be looking at possibly an extension because we're moving into the holidays. The idea is to have a partnership with Comprehensive to have a permanent location where we can work on essentially what could be discussed as a day shelter or a drop-in center where people who have issues, concerns about their mental well-being or homelessness or drug addiction can provide services. Our goal, what we envision collectively, and I don't want to speak for Comprehensive, but the idea is to have a relationship and a location, a permanent location where we can provide our harm reduction services to complement the work that Comprehensive does and also increase the opportunities for other organizations to partner as well. Our goal at the health district is not to be in charge of any of this. It's not to run any of this. It's to convene opportunity. And so we envision having a space that's clinical in nature where we can provide services as we do on our mobile unit, our RV, which is wound care and naloxone education and testing and needle exchange, but also make that space available to other partners. And so the funding that we receive from a foundation, mind you, not the public's money, but a foundation, is to jumpstart that opportunity. So again, that's part of our mission here as well, is to blend funding that allows us to be innovative and create these partnerships. We try to spend federal money first and then state and local. Again, we're trying to create this catalyst model using foundation dollars. And then our job is to make good on our relationship with that foundation so they'll invest more in rural America, because traditionally foundations will look to solve problems in communities with the largest number of people. And again, we are sharing with them candidly that the needs of rural America are important, and we want to serve as a model for that kind of innovation and then share that with other organizations as well. We are going to make a change with part of that funding. We had discussed the purchase of what's called a utility ATV, all-terrain vehicle. Ryan and I spent a lot of time finding out the many different models that are available in Yakima County and Washington State, and not many available. And so we were looking at a 6 to 9 month waiting period for these things to be built, which won't help us in terms of our work and also wouldn't meet the criteria of the partnership with the foundation. So we're looking to pivot to creating what we call anchor partnerships. Essentially, we're recognizing that many of our partnerships that we relied on during COVID were relationship built and partnership built, but there was no funding mechanism to assist those organizations to create well-meaning opportunities. So as an example, some of our partners won't be able to have immediate funding because their funding is categorical. And so we want to have funding relationships. So when they help us because they're prepared to do so. We have certain communities that we know we need to assist in times of great need. We have a very large farming population, and we have people who come in, it's called on an H-2A visa. And we recognize that serving those farm partnerships and serving the communities that they serve is very hard. But as an example, Farm Workers does a great job of working with those organizations. Neighborhood Health has a homeless outreach program, and we rely heavily on their relationships. But as an example, we found during COVID that it's hard to pivot towards providing the potential for isolation and quarantine housing because a lot of the monies actually that different organizations had, even the county had, was specific to COVID. So you can't use COVID money to respond to a monkeypox outbreak, which is a concern for me because again, it's categorical and it doesn't allow us to be nimble. We're trying to use a small amount of money to motivate change with partners. And so that's part of how we plan to use approximately $30,000 of that to create what we call anchor partnerships so that we have relationships with organizations that also want to work on being nimble. One of the anchor partners that we're going to formalize, but you have all been supportive of, is our purchase of hand washing stations that are now housed at the State Fair Park. The idea is that we made an investment of dollars to a community benefit. We are not managing that. It's in partnership with other organizations, but it's to the community's well-being that we're focused. So that's something that we really want to create as a backbone of our work. And again, I want to make certain that we spend time explaining that to you as a board, because we don't want to just do one-off projects anymore. There's too much need in this community. The last piece that I do want to share is that we are also recognizing that we have incredible responsibilities to communicate to you and to the public about issues that aren't in our control. So as an example, we've lost a large hospital that has had an impact on the availability of service providers, but as you may all be reading in the news, there's not a lot of space in our emergency rooms. We have one less huge emergency room in the valley. Multi-Care is going to be purchasing Memorial Hospital. It's a big change, and that's something that we will monitor and be involved in, but it's not something we control. So public health's role has never been to be in charge of these actions, but we do recognize our vital role in trying to serve the entire community and communicate the needs of the many different populations within our community. So that was a lot. I don't know if you have any questions, but I'm happy to field them. Any questions?
I have a question. So going back to the partnership that you identified with Comprehensive for the self-harm reduction program, I think it'd be important for this health board to understand exactly what that looks like so we can review, is it expansion of this program? Are there going to be new restrictions or guidelines? So I think this board should know what that partnership looks like and what the program is going to look like before you commit to it.
Okay. Well, we didn't envision any changes to the program at all in terms of the expansion of services. Our goal has always been to house a permanent location. So let me just say first off that we don't anticipate new changes to what we were doing, but we will be working with Comprehensive. So we could bring that to you on the 27th, was it? 25th of next board meeting, which would be our first board meeting in person.
Well, in previous conversations, we discussed collecting different data. So I'm just curious if there's going to be a movement towards that. Specifically, we wanted to identify specific individuals instead of serving 4,000 people. We'd identified that we wanted to identify specific individuals and how often they were coming in, and then better traction of whether or not those people actually interacted with services for outcomes. So those are the kind of data points that I know this board had discussed. So that would be what I'm driving for.
Thank you, Commissioner. I hear what you're saying. One way that we collect data is what's called encounters rather than individuals. normally we talk about encounters because you might have an individual who comes back for services 10 or 15 times. And so we can certainly keep track of that data in both ways. I will share with you candidly that the services that we provide are confidential. They are medical, and so we don't identify individuals. We do keep that private, but we can certainly share that information. But in terms of the actual outreach that we do in terms of services, I don't anticipate a change to those services. What we're looking for is having a permanent location where we can not just use a mobile van, essentially. But we can bring that to the board next month. I will share with you that we're dependent on time, so we'll really have to make a decision at our Board of Health meeting next month. If that's something we're moving forward on.
Any other questions or comments? Seeing none, we'll move on to our Chief Operating Officer, Mr. Eibach.
All right, on our January 25th meeting, we'll be introducing and welcoming 3 new board members. We'll be introducing Kyle Curtis, who will be commissioner and be taking over for Commissioner Anderson's position. We'll also be introducing Lupita Carrillo, who will be their city representative position that will be taken over in Nyla or Councilmember Duvall's position. And she comes to us from the Titan City Council. And then our city representative position that will be taken over in the position that Dr. Clary currently holds is Edie Dibble, who will be our citizen representative that will be in the position of the medical and public health position. So we look forward to welcoming as we thank the outgoing board members. We'll look forward to welcoming the new board members. Also, an update on the illicit drug letter that has been discussed the last couple meetings that was sent out to members of the legislature of the state on October 28th. And then also we are going to be advertising for, or we are currently advertising for office technician position at the Yakima Health District. And that closes the Sunday, December 11th. So if you know anyone that is interested, that would be a good person at our front desk, please send them our way. And then our next meeting, January 25th meeting, we are required first meeting of the year to select a chair and co-chair. So that will be done at the beginning of that meeting. And finally, I want to thank board members for their input and responses to the performance evaluation questions that you sent out. We are looking through those, identifying action items, and we'll be working closely with the board on those action items, and also helping to answer any questions that were brought up in those responses and providing the clarification of the next board meeting.
Okay. The update on the tribal, we're still looking for information from them on the board members they are going to select for us. Is there anything there?
No, but that's not unique to Yakima. My understanding is that that's been throughout the state. Commissioner McKinney's on the Wasatch board. She can speak probably more to it than I.
We just had an annual meeting, and no, there's been no communication on any level. So we wouldn't, I don't know whether or not we're going to hear anything for, it's a big question mark still. Yeah. No agency has heard anything.
For clarification's sake, James and Ryan can say it better, but that does determine what a quorum is, because we only have, we're one short a staff, or rather a board member. So if the board member comes on, that changes quorum and so forth. But right now we'll just be a 9-member board.
Okay. Any comments or questions? Okay. We'll move on to Melissa, who is going to be reporting on behalf of Dr. Barb.
I will not do this jump, but I will do my best. So Dr. Barr just wanted to report that there's been a 26% increases in COVID cases over the last 2 weeks, likely to be underestimated due to at-home COVID tests that are not being reported to the state. The influenza numbers are high, which I'll talk a little bit more about in my report. One big thing on monkeypox, the name has now been changed to Mpox. We are seeing a marked decrease in cases of less than 10 cases per day now, down from 450 cases per day, which could be contributed to the vaccines and a response from public health. And the emergency declaration ended because of this. So we deactivated the Brian will talk more about, but no longer just plan for that. Fentanyl in 2021, there were 107,000 deaths due to drug overdoses. There was reports of an infant's life saved by Narcan administration after an accidental exposure at a playground. And that fortunately, because people have Narcan more available, it's potentially saving more lives.
Okay. Any questions or comments?
The question would be, having a department set aside any funds for the RSD all the RSD and
Well, we don't actually, administer it, but I can talk to some of the work that they're doing. Do you have any?
Just that RSV and influenza are not notifiable conditions unless it's an outbreak within a long-term care facility or a death. But we do work closely with the hospitals, ensuring that the hospitals are not getting bottlenecked due for long-term care placement. And then also we do a vaccine campaign for influenza.
But I did want to share that we have seen, and this is true around the nation, is that routine vaccinations have decreased.
Mm-hmm.
So we are in what's called a triple threat environment right now between RSV, flu, and COVID. The idea that if your health is imperiled by any of those things, if you have it at the same time, it can be very difficult. It's extremely hard on small children, infants. I think our goal, again, is to really reinforce these traditional outreach programs and have these partnerships with school systems and with clinicians to really reiterate the value of getting vaccines and making it easier for families to receive those vaccines. I think that's another thing, is that a lot of people, when they're busy, they don't think to take their children to the clinic. So we want to make that much easier. So we're hoping that the board is supportive of that, because we really want to increase that. We've done a good job of that, but I think we actually have to make very clear that that's something to do throughout the community. Does that sound good?
Okay. Any other comments or questions? Okay.
Ron, I just wanted to let you know about his meeting.
Oh, good. Okay, thank you. Welcome, Commissioner.
Thank you. Sorry, that it took a little longer than I thought.
Let's move on now to the local emergency response report. And today Ryan is reporting on behalf of Nathan Johnson.
Okay, so Nathan did give me a report, and he just wanted me to let the board members know and the public that since the last meeting, we have demobilized from the monkeypox incident command system. This is pretty big, because this is the first time in 2 years and 9 months that we have not been an incident command system structure. So we're pretty excited about that. But that does lead to more work. We are working on an after action report for both of the incident command systems. And so it will start out the internal survey for staff will be sent out here shortly in December, so we can get input. And then after that, there'll be an external partner survey that will be going out, and that information will go into our after action report, which will be used to, as far as, what we did well and how we can improve in the future. I'll have to be part of emergency management.
Thank you. Any questions or comments? Hearing none, we'll move on to disease control by Melissa.
So really the only thing I'm going to speak about is the RSV and flu that's going on right now. As everyone knows, RSV flu activity is really, really high right now, not just locally, statewide, but nationally. Our hospital systems are becoming strained. They're reporting increased wait times in their emergency rooms, anywhere from 2 to 6 hours. Urgent cares are full. We're seeing a lot of flu. There's been 13 deaths in the state of Washington so far this flu season. 2 of them in children ages 5 to 17 years old. I don't know the information as far as whether they were vaccinated or not. That's all the state really puts out in their reports. None in Yakima County. We haven't had any long-term care outbreaks for influenza, but we are working closely with our long-term care facilities for infection prevention, control, and prevention. Our positivity rate, we get reports from the local hospitals on RSV and flu numbers. We don't get them from outpatient clinics, but we for our hospital reports, our flu positivity rate is 27.6, and RSV is 31.5%. And then also the state looks at what they call ILI, or influenza-like illness emergency department visits. The baseline is 1.8%, and it's currently at 12.9 for the state. So we're seeing a lot statewide, and I know our hospitals are maxed out, not just locally, but statewide. They're really filling it over on the west side as well.
Thank you. Any questions or comments?
I would just comment that the ILI reporting that we probably don't do as many people as we think there are here. We're not capturing those people, but obviously you can't. So, it's just something to keep in mind with the number that is higher than that.
Okay. Any other comments or questions? Seeing none, we'll move on to environmental health with Mr. McGee.
Morning, everybody. Happy to see everybody here in person. Main thing I want to touch on from environmental health standpoint is the two landfills that we currently are working with on a few different issues. I'll start with the DPP landfill at Rocky Top. Currently, what we're working on there is getting a liner system installed throughout that the entire facility. As there is evidence that the very design liner, meaning there is no liner that's permeable there, have been compromised and aren't originally previously laid out in the original landfill design. So the best and DPG agrees and is cooperating fully with to install liners throughout the entire facility. Future and current active cell area. So we'll work forward with that. Hoping the goal is to have the proposed liner engineered design by the end of the year. We'll be working with DPG on that. As for the gas emissions coming from DPG from potential underground fire or mold, the State Department of Ecology has initiated MOTSA process, which is Model Toxic Treatment Act, with the state's version of but anyway, so DPG and Department of Ecology are in negotiations within a free order, which basically means both parties agree on the process in which they're going to determine the source and the problem and how they're going to. So that's where they're at that process. We are involved. We are being kept informed, and we will assist the Department of Ecology in any way we can. But we are not necessarily the authority for the ecology topics in that department. However, we are still overseeing the day-to-day operations of DPG. Happy to report that they've implemented much more rigorous waste screening processes at the landfill. We're not seeing nearly as much. We haven't seen in several weeks any unacceptable waste that have to fire units with all waste. It appears the screening process for the day-to-day operations really working well at this point. So we continue to monitor that and monitor on that as well. Moving over to Peyton landfill.
Before you do that, Sean, may I think it's important to say that MACA is just like CERCLA. And so we've had a couple of folks I know who've reached out who are concerned neighbors about what the county can do. And you just described it very well. Once MACA is invoked, it's very much like CERCLA. They are the driving force. We are a partner and continue to do what you do for enforcement, and same with our planning or permitting department, but the state has the lead on this. And it's very simple, similar to what happens over on the training center. And then the other item I think it'd be important if you could just touch on is that there has been a change in ownership proposed for DTG, and I believe it's closed. So could you just confirm for the public that any ownership would still have to comply with all of the items that you just described?
Well, absolutely. We've heard the same thing as well, that there is some ownership. I've heard a couple of different reports that it's more of an investment group, maintaining operation. But I've also heard the other side, is that DTG is no longer going to be DTG, it's going to be Macquarie. So at our next scheduled meeting, we are going to be discussing, exactly who's taking control. Is it still going to be the same people and DTG's name, or is that all getting changed out? Because that would, require a permit to be reissued to the new ownership. And yes, the new ownership would be required to continue to work through the issues that are currently going on and bring the facility back into compliance with the engineered liner, Department of Ecology market process, and still continue to make sure the day-to-day operations are. Thank you for bringing that up.
Question. Yeah. Is there a root cause analysis as to how they got so far down the pathway and leading to this contamination?
Right, yeah, and I think that that's what the monitoring process will bring to light, is what got into that landfill, how extensive, what caused it exactly, and that will allow us to pay attention and identify, certain types of waste that may not be appropriate for the purpose landfill that maybe we thought were appropriate for. Maybe, it could be kind of trickling contaminated soils that need to be remediated. We don't know that yet. But we're hoping that Montana identifies that, and we can put in future permit some additional guidance and restrictions on what we're going to do.
There's also a question mark about the deficiencies in that timeline. So DTG's only owned it for a couple of years. So they're trying to identify too, are these things that were deficiencies long ago? And it could be that just the permitting scopes back when it was originally started, just maybe they need to be changed for present day going forward.
And we don't know. Yeah.
If I may, Dr. Atterbury, you're bringing up a good point, though. Right now, because of this remediation process, we're looking backwards. The reality is that we're trying to focus on what future opportunities look like. So moving forward, it's a big change to have a liner. This community was always known as a place where that was never necessary. That's a very big change. And one of the things that we also recognize is that we receive waste out of state. And so we really want to work very closely with our state partners to ensure the integrity of the process so that we avoid this happening 20, 30 years from now. Because again, that's very complicated. It's a very expensive process. And also it's a bit of a complexity when we have responsibilities for oversight at the local level, but we do not, we're not necessarily responsible for the creation of the situation. I don't know if I'm saying that correctly, but essentially there are some vague areas that we want to really advocate for because of our rural nature and because this is an ideal place for this kind of development. We want this to be ideal for the future and frankly, for the neighbors who live around.
Okay, so the Peyton limited purpose landfill, we recently, over the past several weeks, gotten reports of spot fires happening, smoke and steam coming from the active fill area. We've been very responsive and been out there multiple times every week. And what we've identified with the concerns of the Department of Ecology is that there is a possibility of fire going on in that fill area. So we have sent a letter to Peyton landfill, the courtesy copy of Ford County Commissioners, Department of Ecology, several of our partners, Yakima County Planning, to request that Peyton has revamped or readdressed their fire control plan or fire response plan, as it was a little vague in the current ops plan, but we need to see more a robust response plan outside of relying on the fire department response, because the volunteer fire department up there in that team doesn't necessarily have the manpower, the equipment to fight fire. Peyton is working with a landfill fire consultant. He needs to be hired, so that's great news. That will help Mr. Payton know what next steps are going to be. Going to be a good liaison to communicate what's going on with regulators, local and state. That letter that I mentioned earlier, it is directing ownership at Payton Landfill to provide accredited third-party environmental consulting firm that is qualified to be air emission sample, gas emission sample. We want to sample the smoke and the steam that's coming out of that. Also subsurface sampling with temperature to confirm if it's a fire, if it's a chemical release of some kind, what exactly is happening. And that will really drive our future response to what will happen with that area. Also, we have directed we need to eliminate the introduction of oxygen into that area and self-feeding fire. So there is a cover, soil cover going in the entire area to seal it up and try to smother what's going on in that package. Also, we are directing to provide daily cover on any unit to eliminate future hotspots or fires. That's where we're at with Payton. We are heavily involved with that. We are communicating with the college almost every day about what learn working with DPP. We do have opportunities. Are there any questions on? Other than that, we have new staff. Andrew here has been working hard to get trained. Recently has now been able to venture out on his own and are doing our food inspections, which is critical to our biggest program. We inspect under 1,400 food establishments after that program, and now training to continue across all of our other programs. And that's all for me.
Thank you. Any further comments or questions before we move on? Our next report is, we're not going to have the next report. And so we'll move on to unfinished business. And my information is that we do not have any unfinished business. So with that, we'll move on to new business. And the new business is the proposed motion to approve a salary step increase for the executive director, Andre Fresco. Is there a motion to do that?
Second.
Who was the first? Oh,
Dr. Atterbury.
okay, thank you. Been moved and seconded. Any further discussion, comments? Hearing none. Would you like to take the roll, please?
If you're in favor of the motion, please state yes. If not, please state no. Commissioner McKinney.
Yes.
Commissioner Lindy.
Yes.
Councilmember Byers.
Yes.
Dr. Atterbury.
Yes.
Dr. Cleary.
Yes.
Stephanie Ogren.
Yes.
Baleen Ackerman. Yes. Councilmember Duval.
Yes.
And Commissioner Anderson.
Yes. Thank you much. It's been approved. And so with that,
Would anybody like to comment?
anybody like, yes, would anybody like to comment on that? Sorry.
That's okay. I just wanted to say that I appreciate the leadership, Andre, that you have given the health district and the cooperation working with the board all the way through, even through the disagreements during COVID. But your leadership has helped move our community forward. We all know this is a community of high poverty and lots of needs, and your focus on that particular part of our difficulty and your leadership through that in terms of staff development and innovative programming and outreach to get funding through the state and the government as well. I just appreciate all of that and your communication skills and accomplishing everything you have.
I would just add again, my thanks. I know we discussed it earlier, and this is something we can bring up, is that your care and concern for the rural community is evident, and we do have an equitable access to healthcare issue. And one of the ways that we're going to thankfully be able to resolve that is with heavy investments in broadband throughout Yakima County, inclusive of the Yakima Nation. And that will be something that you and this board will be able to partner with local, state, and federal government agencies to really make that something that we see come into fruition, so we can really see an increase of access to healthcare.
Any further comments or questions?
I would just add that on that same note, I'm very with your real asset like you did note about the bunch of people and furthermore, I think that on the note of access to care, we should do everything to help facilitate developing programs that will help increase the number of providers. And the great things that they're doing in some of the development projects, anything we can do to facilitate getting more and locally, they're likely to keep them locally. For other rural communities in Washington State and in general, to help facilitate getting more people from patients who won't have their goal to try to help.
Yeah, thank you so much.
Yes, sir.
I'd like to make a comment on another subject. I just want to thank Megan Tweedy for coming today. I think it's really valuable for the board to be able to place a face to a name, particularly when we're talking about the substance use disorder and self-harm reduction programs. I think we need to kind of expand our image of who we think benefits from these. Jeff was a friend of mine. He was an intelligent, hardworking, handsome, fit guy. He had a lovely family, 2 beautiful young daughters, and his loss is a terrible thing for the community. He has an extended family that's incredibly valuable to the community. And if these programs will save one person like Jeff, they're worth the entire support of this board. No matter who you think may benefit from it, people like Jeff are just not to be lost in this community. So we need to support these programs.
Thank you, sir. Any further comments or questions or anything?
If I may add one more thing, I'm sorry, go ahead first before.
No, I was just wondering, invite the 3 in the back there if they have any comments. No, okay.
I had an opportunity at the Downtown Association meeting earlier this week. Dr. Kaminsky was there from Yakima Valley College, and they are doing an amazing job of extending their nursing program and other medical support. So I think in having conversation with the college in terms of the need, some specific needs in communication with other health providers in the community would be very helpful. One of the partnerships we can look at, and I know that you are very capable of that, certainly. So thank you, Andre.
Can I make a comment? This is exactly the type of direction that really helps us. We have enhanced funding that's part of our adopted budget that you've already adopted. This is the kind of thing that under the direction of the board, we can really make good on. We don't want to make investments that are just one-off. We want to create the foundation, as Commissioner McKinney talked about, broadband access, the idea of keeping providers in this community, really reinforcing what's possible outside of the traditional focused areas, like whether we have a hospital. Do people want to be here? Do they want to serve? And if I may just mention not only my appreciation and the Fresco family's appreciation for your continued support of me, but I do want to share with you that I'm grateful to work with a dedicated team that really love to come to work to serve the community. And no matter how hard the work is, it's really a great honor to see progress because that's what the people deserve. So thank you.
All right, thank you much. I would like to say I've been involved with this board for 6 years now. This is my last meeting. It's been an honor and a pleasure to work with everybody who is here and who is going to be coming on. I hope that you continue to carry that torch forward and make things better as everybody, our members, transition off of this board and onto new things in their lives. But the core mission of this health district is going to continue, and I hope get better, as I know it will, because that's where everybody is focused on, is getting better, doing better things, doing them not just better things, but in better ways. And always looking out for new opportunities and methods of doing things. So it's been an honor to be here and to serve on this board, and I do appreciate it. Thank you. And with that, if there's no other business, I will ask for a motion to adjourn.
Motion to adjourn till our first meeting in January 2023. Oh, sorry, go ahead.
You guys want me to say something? Oh, I just, a lot of what you guys said really resonated with me as well. Andre, your leadership is very valuable to the health district. This is a great place to work. And the people that serve here, I'm very grateful for all the hard work that you do. I really do think that Andre is the best person to lead the health district into the future, serving people that are in crisis, that need help, and or that need our services. So thank you for all your hard work.
I would like to just lastly say, I think we all should give ourselves a hand, just because I think this is a great team. And I think we're going to be moving forward in a great strides and continue the mission. So again, thank you all.
Thank you.
And there was a motion. And
I made a motion to adjourn to our first meeting in January 2023.
There's a motion and a second to adjourn. Any discussion? Hearing no discussion, they're all in favor?
Aye.
Any opposed? Thank you much. We are adjourned.